Hello everyone, my name is Mary Clow. I am an Indiana State University nursing school student, and today I'd like to present to you a presentation on type 2 diabetes mellitus. We will be focusing on our Hispanic and Latina communities. Right now, if I could get you to please pause the video for a moment and take our pretest and see what you know about this subject. It is provided in English and in Spanish. Thank you. Welcome back. This is what I would like you to learn from our presentation today. How often diabetes happens in our population. What it means to have diabetes. How to recognize symptoms, what the treatment is, and then we will talk a bit about life, living with diabetes, and the fact that type 2 is actually preventable. It can be prevented with some lifestyle changes. According to last year's U.S. Census from 2020, approximately 62.1 million people of various Hispanic ethnicities and backgrounds reside in the United States today. Right now, we are celebrating Hispanic Heritage Month, where we recognize the contributions and diversity brought by the Latino and Hispanic populations to this country. Thank you so much. When talking about diabetes, most people think of two different types. Type 1 insulin-dependent diabetes or type 2 non-insulin dependent diabetes. We are going to be discussing type 2 non-insulin dependent diabetes because that is the type of diabetes which is affecting our Hispanic populations the most. If you take a look at my slide and you see this little purple organ right here, this is your pancreas. Your pancreas is located behind your stomach, and its job is to secrete a hormone called insulin and pair with glucose to go into your bloodstream to fuel the body. Kind of like putting gas in a car. We eat, the food breaks down in the body, turns into glucose, it pairs with the insulin, goes into your bloodstream, and then goes throughout the body and produces the fuel that your body needs for you to function. Of our 62.1 million population, 17% of Hispanic or Latino ancestry will develop type 2 diabetes, as opposed to just 8% of Caucasian or white. The Centers for Disease Control give us an example even among ethnicities. So, for example, if you are Puerto Rican, you may be 2 times as likely as a South American to develop type 2 diabetes. Hispanics were also twice as likely to be hospitalized for different complications stemming from their diabetes, and also, unfortunately, 1.3% more for a higher death rate. Here are some of the most common risk factors for developing type 2 diabetes. Being overweight, having high blood pressure, being over the age of 40, and if someone in your family already has type 2 diabetes. Some of the most common symptoms of diabetes are urinary frequency, being hungry or thirsty even if you've just eaten, being sleepy during the hours you would normally be awake, problems with blurry vision, numbness, tingling, or pain in your hands or feet. Low blood sugar symptoms vary just a bit, and they would be headache, shaking, sweating, and weakness, along with feeling tired and hunger. This can indicate a medical emergency, and it is very important to recognize these symptoms so that they can be treated. Let's talk a little bit about prediabetes. Let's say that you have gone in to see your primary care provider and had a yearly checkup, and after some tests, the doctor says to you that you have prediabetes. What does that mean? If you look at this chart, we see on the left-hand side is a normal range, and the cutoff normal for that range is 140. To the far right, we have a diagnosis of diabetes. And if you look above it, the number 200. So in between this little area between normal and diabetes, we have prediabetes, and the number ranges from 140 to 199. Do you think you could be at risk for prediabetes? I've included a short quiz in English and Spanish that will be located at the end of this presentation and also on the brochure as well. And here is a random fact for all populations. 84% of the population has prediabetes, and the majority of them do not even know it. This is a good picture to help us see some of the problems caused by diabetes, like brain disease, eye problems, tooth decay, heart disease. Having diabetes is one of the biggest risk factors for heart attack or stroke, nerve problems, and chronic kidney disease. The incidence of chronic kidney disease in the Hispanic populations is also very high due to the increased problem of diabetes. Other complications can include loss of sexual function, problems with wound healing, especially in the feet and lower limbs. A rapidly worsening diabetic wound can result in an amputation and is actually one of the most frequent causes for amputation. Type 2 diabetes is treatable and, in many cases, reversible. Sometimes making a few changes in your diet and adding exercise may be all the treatment you need to set you on the path to recovery. If you or a loved one have diabetes or think you might have diabetes, make an appointment with your doctor. And here is our ending quote. Sí se puede. Yes, you can. Take back your health. For yourself, for your family, and for your community. These are the links to the quizzes and material I've mentioned in my presentation in both English and Spanish. These links are also provided for you on the brochure. Gracias! Thank you for listening to this presentation. Don't forget to take the post test located in the description area of this video.